The UN says the number of confirmed Ebola cases has reduced in 3 worst affected West African countries. But the fight is far from over. Health ministers and medical experts from all over West Africa met in Dakar. The purpose? To speed up the evaluation of potential Ebola treatments and vaccines.
The African response is crucial. Ebola revealed that we were disorganized in many ways, and foreign intervention was able to come in and implement certain strategies which we don't disagree with, but we feel that those strategies should be harmonized and strategized in such a way that it is focused on the problem and not several attempts in a disorganized and chaotic manner.
Unprecedented clinical trials are taking place in affected countries. One of the trials involves using blood donated by Ebola survivors to treat sick patients.
There's a great hope in eradicating Ebola in West Africa, because one of the roles we as survivors are now playing is to help donate plasma, and these plasma are going to also help Ebola's patients to recover. And there are a lot of hopes that we are giving from our positive stories out there to people, and it's actually helping, and we are actually getting rid of Ebola.
There are no clinically proven vaccines or treatments for the virus. Trying to find a cure in the midst of the worst ever Ebola outbreak is a major challenge, but scientists say this could be the best chance they have.
I think there are good news from the field from a purely medical standpoint, but I think we need to look further than that. We already need to look at what can be done after that, what can be done with community engagement, preventing future crises, and building kind of resources based on the experience that has happened. And I think this kind of forum is really looking forward and beyond the purely medical intervention, really looking at what's next after that.
For us in the U.S., we don't have such a forum. We've heard no ideas. We've heard Ebola was solved. And today I find out that there are many ideas, and then with the proper funding and framework, and with a country as advanced, as Senegal has been, and hosting this forum, which is important, I think that there's plenty of hope, and there's also now hope for the next outbreak. When I hear, God forbid there's another outbreak, but when I hear of one in the U.S., I now know, and I have people to contact, and I now know that there are frameworks in place. The next step is to mobilize them and get them funded.
The hope is that the vaccine trials will prove successful and the outbreak will be a thing of the past. Carol, Oyola, CCTV.